Dr. Napolitano, people should have eye examines, getting them regularly examined. We know that people go to a dentist usually a couple times a year, but then again, some of them have to go 3 and 4 and 5 times a year due to their situation. What's the situation when it comes to eyes? When should people get an eye exam? And does that change with age? Like, does a 60-year-old person have to go more often or less often than a 14-year-old child? Give us the insight on it.
Well, up until the age of 30, 35, I would say if you do not wear glasses, if you do not have any health problems and have no symptoms with your eyes whatsoever, no headaches, no eye strain, then every 2 years is a good time frame for an eye exam. And after that, after the age of 35, I would say every year you should have an eye exam, whether you wear glasses or don't wear glasses. Now, especially if you have any health conditions, diabetes, high blood pressure, high cholesterol, heart problems, certain medication that could affect the eye exam might be warranted a little bit sooner than every year, maybe every 6 months.
Which medications do affect the eye? I mean, you probably can't make a list of all of them, but give me a few major ones which might affect the eye negatively.
Some of the high blood pressure medication could affect the eye pressure, could actually lower the eye pressure. So when you come in and we measure the eye pressure, it might be low when we measure it, but in reality it's your high blood pressure medication that is doing that, and something else could be going on. One of the biggest one also, I actually had a patient here this morning, is Flomax, which is used for prostate problem. That could have an effect on the eyes, and it's important to mention to your eye care doctor, especially if you're undergoing cataract surgery. Another major one is definitely a steroid-based medication. That could cause a few things with the eyes. Could cause an increase of the eye pressure, which could lead to glaucoma, or it could also cause early cataracts. So as you can see, there are a lot of medications there that could affect the eyes. Also, any blood thinners, Plavix, warfarin, aspirin, that could also cause bleeding in the back of the eye.
Wow. Wow. I guess that's why the warning label on those medicines is so huge, you know, and and it's so fine print that nobody wants to read it because it would scare the living light out of one. All right. So then elder people, I mean, I think I interrupted you there. Do they have to go even more often than every couple years?
Well, even the elder population, once a year, unless there is something there, unless we have a health problem like diabetes, or unless your eye care doctor finds, you know, your eye pressure is high, we should check it more often, then you should have the eye exam as directed by your eye care doctor. It could be every 3 months, it could be every 6 months.
Got it. I have heard that a eye doctor, as also a podiatrist, for instance, are actually, it's like the other way around. People with diabetes should go to the eye doctor more often, but at the same token, it is the eye doctor who might be discovering that there is an onset of diabetes coming on, and by doing so warns the patient much earlier. Is that true?
That's very true. I did have a few patients. I actually had a very young patient not too long ago. He was in his store. He was about 35 years old, and you know, he said, "Oh, I'm healthy. I have no health problems." Once we looked in the back of the eye, we found a lot of bleeding. And I sent him back to his primary care doctor for a blood test, and sure enough, they found that he had diabetes. The other thing that high sugar, high glucose could do is it could cause a sudden blurry vision, which would prompt the patient to come in. And that's also something that we will discover during the routine eye exam. And a lot of times the diagnosis of diabetes is made through the eye exam.
Why? Because, you know, I guess it's because the blood vessels around the eye are obviously very, very sensitive and thus react to these abnormalities much faster than the rest of the body. Is that kind of like a short a decent, correct explanation?
Yes, in a nutshell, diabetes causes stress to the blood vessels throughout our body. Inside the eye, you find the smallest blood vessels in our body, and that's why the damage occurs to the eyes a lot sooner than it occurs to the other organs in the body.
Good. Well, all right. Wonderful. So basically, get your examination, because obviously prevention is a key, and whether it is that you prevent glaucoma, which could make you blind, and slow it down drastically so that you outlive it, and or whether it's diabetes, anytime you can work on it earlier, you have a better chance of maintaining it and doing a lifestyle change or whatever it might take to do it. An ounce of prevention is worth a pound of cure, or something like that, right?
Correct. Yeah, correct.
Okay. Well, wonderful. Thank you very much. Bye, Dr. Napolitano.